going to be going over my image criteria of an x-ray I performed. This x-ray was taken on September 6, 2017. The patient was a 65-year-old male who came in, or his doctor sent in because he was complaining of lower limb pain and hip pain. And the patient did have prostate cancer, so the doctor sent him into our facility just to get things checked out. For this facility, for a pelvis, you do an AP pelvis and a lateral frog leg. So before I went and got the patient, I set up the room. I set the SID to 40, put the IR in the bucky in a landscape position. I got a gown ready for him, moved the table or the tube head out of the way, and then I went ahead and got my patient. So as I brought him in, I asked him his name and date of birth, verified that I had the right person. I pulled his study up on the computer and went ahead and set everything up. This was done on a Philips machine. The KVP and mass were set at 80 and 25. So I had him lay on the table on his back. I centered the the central ray to midway between the iliac crest and the symphysis pubis, which is where it should be centered for a pelvis. I had him rotate his feet inward 15 to 20 degrees, had him hold still, hold his breath, and then I went ahead and took the x-ray. So just to go over, so I'm going to show you my image here. This is the AP pelvis that I'm going to be talking about. Let me get a better picture for you. There we go. So some of the image criteria for an AP pelvis include, it should include all of the pelvic girdle, L5, sacrum and coccyx, the femoral heads and neck, the greater trochanters. The lesser trochanters should not be seen, but on some patients they are seen just minimally. The greater trochanters should appear equal in size and shape. There should be no motion evident, and there should be a symmetric appearance of the wings of the ala, the ischial spines, and the obturator foramen. The left and right ischial spines should appear equal in size. The correct centering should be evident by demonstration of entire pelvis and superior foramen without foreshortening in the collimated field. You should see optimal density and contrast with no motion. You do use a grid with a pelvis, and the SID should be set to 40. You should have good radiation protection and shielding if possible. The trabecular markings of proximal femora and pelvis structures appear sharp, indicating no motion. And you should have collimation on all four sides of the anatomy of interest. So that's the criteria that you should see for an AP pelvis. And so we're just going to go through that and see what I should have done or could have done better for my x-ray. So like I said, this is my AP x-ray. So a few of the corrections that I'm going to go ahead and point out here, first of all, is you can see the lesser trochanters here. They are seen very well, which tells me right away that the patient did not have his legs and feet rotated inward 15 to 20 degrees. And so that is definitely something that should have been corrected. You can also tell this has a lot of shades of gray, and it tells me that this is not a very good contrast, not a high contrast image. You can tell if you look, you can see the soft tissue markings of the patient, which tells me by looking at it that this is a rather large male. And so technical factors should have been adjusted for his size to produce a more optimal image. And another correction is right here in the lower right corner. That is my marker. So you can see the R for right, but you cannot see my initials, which is definitely an error that should have been corrected. Fortunately, on the other images I took of the patient, I adjusted and I moved it up so you could see my initials, but that is definitely a correction that needs to take place. So I'm just going to go through now some of the anatomy that I have labeled here. This right here is the ASIS. We have the sacroiliac joint, which that's on this side and on this side, which is the joint that connects the ilium and the sacrum. You can see the sacrum here, but the sacrum is kind of hard to make out. Again, that's just because the technical factors that were used. So that should have been been able to see better on this image. You can see here the femoral head on both sides. We have the crest of the ilium, or the iliac crest. Down here we have the obturator foramen, which again is a good indication to be able to tell if the patient is rotated. Right here we have the symphysis pubis. Symphysis pubis. Down here we have the ischial tuberosity. And over here we have the greater trochanter, and you can see those on both sides. And then the lesser trochanter, I'm not sure if I've said that already. So yeah, and so with the greater trochanter, you can already tell that the patient was not in a great position because you can tell with the greater trochanters here, the size and shape are different. So there's definitely some corrections that needed to be made to this image to be a more optimal image. Okay, let's put this back up here. Okay, so those are some of the corrections, errors and corrections that should be done. Now the findings of these x-rays were that the gentleman was just experiencing pain that unfortunately is associated with prostate cancer, lower limb pain and swelling, and pelvis pain is just part of the symptoms of prostate cancer. So I'm going to show you my image one more time here and let you, if you can, do you know what these are right down here? Those little pebbles there are radioactive seeds that they put into people with prostate cancer to help combat the cancer, to help fight it. And so those can also cause pain too and discomfort. So those were the findings. There was no additional injury or anything. It was just the pain associated with that. So overall, I think I had some good points, good collimation on my image. All the anatomy was included in the image. It was just a few things that I could have done better and we'll learn from for next time. And so that is it. So I appreciate you listening and have a great day. Okay, thank you.